Pregnenolone, now this is probably new to you, is a memory hormone, but it also has other roles as well. So Martha is 47 years old. She used to have excellent memory. She never forgot anything, but recently she has to start writing, having shopping list. She's confused, she's distressed, and she relies on writing things down to remember. Okay? So that's a pregnenolone deficiency. It is a neurotransmitter in the nervous system, responsible for memory, repairs traumatic nervous tissues, helps in joint pain. Also, it is increased by eating meat, poultry, butter, saturated fats, and levels decrease with age. A lot of other hormones depend upon pregnenolone as well. So it's nice to correct that hormone as well, and you can test that. So symptoms can start in childhood, it can start in adults, it can start from stressful situations, and it can be related to other hormones as well. Sunken eyes, pigment spots, thin hollow face, sharp wrinkles, dehydration sign, foggy, absent-minded. So some people come to us and say, I feel foggy in my brain. And they also have small breast, thin muscles, they have high heart rate, cramps in the abdomen, poor body hair, thin muscles, and underweight. So you can test yourself, and then we can test pregnenolone at 8 a.m., blood test after rest, no physical activity or stress, and we can treat. We start with a higher dose of 100 milligrams a day for 4 months, and then we maintain it with 50 milligrams a day for the rest. Good sleep will help, and good diet will help.